guys, welcome back to my channel. If you're new, welcome. My name is Carolina and today I wanted to talk to you guys about my advanced med-surg term. I passed my term and I am on my way to starting preceptorship in like 3 days. So I am really excited to be able to be or have made it to this point. It's so surreal to me sometimes. I'm like I got a second chance to be able to complete nursing school and be in this position. And so the next step would be, you know, to be a new grad and get a job and all that stuff. So that still awaits me in the coming weeks, which I've been thinking about it for the past months. Like, how am I going to like ask for letters of recommendation, which I'm working on right now. I am working on, I'm not just gonna ask the professor like, can you make me a letter of recommendation? Like, no, like I'm actually gonna write like, not like a whole page, but I am gonna be like, well, to the professors that I want to ask, especially my clinical professors, I'm gonna be like, you know, giving them a whole letter, like asking them like, can you give me a letter of recommendation? Not in that like those words, but you know, like why I want their recommendation, why I deserve it, what I want to do, what's my motivation, what kind of nurse I want to be, all of that stuff, right? So I want to do this whole organized thing so they don't think I'm rude, and it's the proper way to ask for a letter of recommendation. So I'm getting that ready because I want to apply to new grad residency programs, which is like the first one is like in March. They're accepting applications, so it's like right around the corner. It's like a month away. So I want to have everything prepared a week before, so I'm not like, you know, scattered. Yeah, so I want to be ready. But anyways, advanced med-surg. I wanted to talk to you. Well, actually, I wanted to make this video because I wanted to give like my tips and advice on how to organize my like notes or like my term, like not agenda, folder or notes for advanced med-surg mainly. I wanted to show that to like new students or students going, nursing students going into like advanced med-surg or any med-surg, because these notes, you will, like they're useful to do them like this in the beginning. So hopefully any nursing students, if you are just starting nursing school, this will benefit you hopefully throughout the whole nursing school journey. This way, if you organize your notes like this every time, it will be organized. I learned this to do it this way because I was not this organized in some of my beginning terms, and I regretted it so bad because there were some notes that I kind of misplaced and for intro to med-surg, and I had to basically redo my notes, quick notes, because it wasn't as thorough as I wanted them to, because I didn't organize my notes as much that time. I was still doing notes and stuff like that, but I don't know what the heck I was thinking. Yeah, I was a little disorganized. I was still organized, but to me, because I'm so organized, like to me disorganized is like, I don't know, organized to somebody else. 1 second. No, honey, no. Okay. My son over here trying to pull my ring light. Okay, yeah. No, you can't take this either. Honey. Okay, take this. You can take that. Take that. Oh, he's not happy about it. 1 second, I'll be back. Okay. Okay, I made him happy now. Anyways, I just wanted to get on here and kind of recap my advanced med-surg term and say that it was a term where I got the opportunity to go back to a clinical site and work with patients, and I learned so many skills that I had not had the chance to work on, and especially like talking to patients. And there's still a lot of skills that I was unable to do, like inserting a Foley catheter or an NG tube or stuff like that. And those are like hard, not like super hard, but they are things that you get nervous to do, and I wasn't exposed to them. Not even like I was exposed to IVs this time again, Leave him alone, please. But he's fine. He's happy, Leah. Don't bother him. So there's like things that I was exposed to again and things that I wasn't. So I'm nervous because I'm gonna be a new grad soon and I still haven't had those skills like done. Like I've done them on a dummy patient, but I haven't done it on a real patient, which is like I'm nervous for, right? And so we did telehealth the weeks that we weren't able to go to sites. So we did still communicate with the patient, like each. Like it was two patients, and then one we interviewed 2 times. We interviewed and then we did a teaching the second time, and we taught about like things that she was concerned about with her health, like she was concerned about COVID and the vaccine. So we did teach her a bit about that and like vaccine wise, like which one to get or stuff like that. And of course we always recommend, not recommend, but we advise that she speaks further with her physician because that's the right thing to do. And my lecture was really good. I was worried because I had one quiz that I didn't do so well, so I was nervous. I ended up getting a B. I don't know if I said that already, but I got a B. So I got a level 2 in my ATI proctored exam. I wanted a level 3, but I was like a few points. If I would have gotten one question, is it one more question, right? No, that wasn't. I think it's like 1% more. I would have gotten a level 3, but I didn't. So something like that. But I was really close. I forgot. I haven't looked at the number in like a few weeks. But I know it was a level 2, close to a level 3. The only level 3 that I've gotten was for pediatrics proctored exam, which was, I was really excited because I do want to work with the pediatric, pediatric patients. So I think that was very beneficial for me, but we'll see. 1 second, honey. And I didn't get the level 3, but I was excited that I got a B in that class overall. It was a good experience. There's a lot of reinforcing of interventions for certain diseases. And I was more organized with my notes this time. So I did, for ATI, the way that I prepared was that I did the quiz back. This is like, because on ATI, I'm not sure if I'm going to be able to insert this, but on ATI, there's a way where you can create like your own quizzes, like NCLEX style questions on ATI to practice, and you can make like different topics and the amount of quizzes, and if you want it to test you or if you wanted to study. So if you wanted the way of study, it gives you like rationales of why you got it right or wrong. They do have like a new format or like layout, so it was kind of confusing to me this time because they like updated a few things, but I got the hang of it. For ATI, because of I got 2 weeks of vacation for the winter break, so I was able to study those 2 weeks, and I did like 530 questions. So that helped a lot. But I feel like there was a few that I didn't read the rationale. So I feel like I didn't quite understand it as well. So I guess that's why I got a level 2. But it is what it is. I'm always on top of my stuff. I was very organized. I always try to be as organized as possible. This is why I buy the Erin Condren agendas. I'm already getting ready for preceptorship. Let me show you a little glimpse. Okay, so this is January. Okay, and this is the last week, which is this coming week. So I already have like my week 1 and like when my lecture is or my clinicals or like skills. I have to do skills validation the first week, so I have to go, and then my orientation is on Monday for clinicals. My clinicals are gonna be on Wednesday from 6 a.m. to 6:30 p.m. and my lecture is gonna be Thursday, and I do have a nursing capstone I don't know if West Coast is the only like nursing program that does capstone, but that's basically like where you have discussions and papers, and I think they also help you with your portfolio, if I'm not mistaken, or like stuff like that. So yeah, I have that. So it's like a bunch of little work. I'm sure, I know preceptorship term is a lot of quizzes from each, like from like the beginning, so gathering all the information and like piling it onto one term. Like each week is like, first week I think the first quiz thing that they're gonna do is like on fundamentals and all that stuff. The skills validation for preceptorship, wait, actually I don't want to get into so deep into like, what's wrong? Honey, can you be careful?
I just asked them that.
Okay, did you apologize?
Yes.
Okay, because you guys need to be careful. Jeez Louise, every time I want to make a video, this happens. Okay, yeah. But anyways, I always lose my train of thought. Okay. I don't want to get too much into detail about preceptorship because that's coming up, and that's like, I'm gonna do another like week in the life or like a day in the life or stuff like that about preceptorship. Alright guys, so this is my tripod. I broke my mini tripod, so this is what I gotta work with. And I have my ring light. My kids are being noisy out there. I use books as my tripod. I have a big tripod, but I didn't want to get that out because it's like a whole big thing. And then this is my folder for my notes. My son's right there. He was crying because he wanted my makeup bag. I took out all my makeup to give him the bag. Now he doesn't want it and he wants this cup. Yeah, anything to keep him entertained while I try to make a quick video. But this is my advanced med surg folder. I showed you guys the empty I did not have this in my week in the life, like starting advanced med surg. My folder was empty, guys. Now it's pretty, you know, complete. So let's open it up, and I have my blank pieces of paper. I had showed you guys how I organize like what's like my to do. I do it on my agenda, and I always do it here. I don't want to get into too much detail because I talked about why I do this in my my video, one of the videos that I made about starting med surg, advanced med surg. And these are my weekly topics, mostly on what I did my notes on. Week 1, week 2. I did not have this in the beginning. This is what I did after to organize for my final. And this is for clinical, and this is for medical ethics. All right, so I did a week. I showed you guys in my other video, but I wanted to briefly talk about it. I did week by week notes, so I just wanted to keep it as organized as possible, and this method helped me for intermediate med surg, but this time I did it a little more organized. So for week 1, I did my notes on the topics and chapters that were of that week, and I did not finish the first week because it was like pretty basic, so it wasn't a lot of notes to take. It was just pretty simple. And for week 2, this is how I did my notes. This is how I like to do my notes. Usually I would always do my notes like based on the chapter. So I would put chapter 27, and then I would start off with the first topic here, and then I would go on with like the next topic would go here. I would put like COPD, right? And I was like, no, like it wasn't working for me the way that I was doing my notes that way. It would take too long, too detailed. This way I would just write this just one page or maybe even 2, like the top amount of pages that I would use are 3. Before I would do like almost, I don't even know how many pages per chapter, but I just like to focus specifically on the disease, tuberculosis. What do I need to know about tuberculosis? I write a brief description on the pathophysio of it, and like kind of risk factors sometimes, because if that's like very important. And then like I put like classifications if there's like different types, or like if there's stages to the disease, I write that because that's important. And like clinical manifestations is big, right? So as long as you have a bit of pathophysio, clinical manifestations, pertinent or like important risk factors that you should know, any complications, diagnostics, like testing things that you're gonna do, and like what medications you're gonna give. That's important. And nursing management. How is the nurse gonna manage it? And that's basically it. So that's tuberculosis. Very simple. And I'm sure you can do it a little more, like less information, but I like to be very detailed, so that's why they're a little lengthy. Okay, same thing with chest tubes and pleural drainage. You know, sometimes I do change the style of how I like format my notes, but it's basically the same information, just like placed in different spots. Pneumothorax. Let's go to another week, okay? But yeah, okay. So week 3 is about like, you know, the heart. So chronic stable angina, that's on top. Unstable angina, sinus bradycardia. Some of these are very like to the point. Like I didn't need to know more. There's probably things I can add, like nursing interventions, but that was drained in my brain. So like for these, I didn't write that, but I probably should have, which I can always go back and do it. But there's some of these I did not quite finish, but they are ingrained in my brain. So I just didn't go back and like write it. And okay, after week 3, I was like, I need to get it together and be more organized. So even for like the week, I started writing the topics and organizing it that way. And yeah, so I found that this way of writing my notes with the disease on top, or like the procedure, helped me so much in remembering what this disease was. My son, sorry. And the other one over here trying to get my attention. So I did that for each week. Let me show you one that I'm like really proud of. Okay, 1 sec. Sorry guys, this is how it is. Where is it? Okay, oh yeah, it was okay. It was the last week? No, this was like the bacterial meningitis, ICP. Okay, 1 second guys. So to me it was very important to memorize bacterial meningitis, viral meningitis, ICP. I tried to make a brain up here, but it didn't come out right. Decerebrate, decorticate, like drawings. Yeah. Glasgow Coma Scale. That's the way that I memorized it, by drawing it. Strokes. The type of strokes, and like right-sided, left-sided. That's just little things that I'm very detailed. I don't know if this is like too much for you guys or if it was good. Let's see. Sorry guys, I'm a little all over the place because my son wants me to hold him. Okay, this is like the renal. I was really proud of myself. I just did like a heart, like what it affected. So this would affect the heart and like the arteries headed to the heart. The pre-renal, intra-renal would be the kidneys being damaged, and post-renal would be the, you know, the ureters and the bladder. And then the stages of chronic kidney failure, stuff like that. And the like burn patients, and like how to know how much of their body is being burnt, or like percentage. Yeah guys, I hope you guys like the way that I wrote my notes. I just like the way that I divided it, because when it came time to study for the final, I just looked week by week and I knew what topics to study. And also, let me show you my final. I did 1 second, it's kind of hard to hold the phone. I did. Okay, here's my final. This is like the final. It was kind of like a study guide that I did. And then, oh, these are like scenarios that I had. But yeah, these are like scenarios that from lectures and like the final lecture that the professor and like a sub did. So I wrote the scenario down, kind of not the whole thing, just kind of like a summary of the scenario and like what the possible answer was or what I would do. So yeah, I did a lot of that, and that helped so much for the final because it was like practically on the final. And yeah, that's basically it. These are other, like, this is my ethical discussions, and then I did like my ethics like notes, reflections, like papers and research things that I would do, clinical ATI like modules that I would do, I wrote notes on. And then these are just like extra things that I kept in the back because like I forget sometimes, so it's like as a reference. Oh, these were like other drugs that these notes I had done in my intermediate med surg, but I took them out because they were like ones that you should know also for advanced med surg. So I took them out and I put them over here because they're really big drugs. And then yeah, that's it, guys. So that was the way that I organized my folder. I hope you guys found it a little helpful and how you can write your notes for advanced med surg and how to just stay organized. I know there's more organized people out there than I am. But anyways, the key to nursing school overall is to stay organized and staying on top of your assignments. That way you have enough time to study and write your notes and not to cram. Anyways, I hope you have a great advanced med surg if you're about to start advanced med surg, or if you're in any of the med surges in nursing school. And yeah, I'm so excited to start preceptorship soon, and hopefully I can, you know, film some of my journey in a preceptorship and as a new grad and all that stuff. So just trying to find the motivation to make these videos as well, and just sit down, and there's just so many videos that I want to make that I end up doing none or just I never know which video to do first, and I just like end up overthinking and not doing anything. And so I need to be a little more organized when it comes to my videos and putting my stuff out there. But good luck and just stay organized, and yeah, we'll get there. You'll get there. I'll get there soon, and we can do this. Okay, so bye.